Right now, as we're recording this, 600 people are suspected of having Ebola in the Democratic Republic of Congo and Uganda, and 119 have already died. But here's what's remarkable. We actually know exactly how to stop this outbreak. Today, we're breaking down the precise playbook that health officials use to contain Ebola, from the moment the first case is detected to the final vaccination. By the end of this episode, you'll understand the 7-part strategy that can turn a potential pandemic into a controlled outbreak, and why every hour matters in this deadly race against time.
Let me bring in someone who can walk us through exactly how this life or death process works.
So let's start with what we're actually dealing with here. Ebola virus disease is caused by viruses in the Filoviridae family, and it's absolutely devastating. According to recent data, the case fatality rate ranges from 25% to 90%, with past epidemics averaging around 50%. That means roughly half of everyone who gets infected dies.
Wait, 50%? That's terrifying. How does it actually spread?
It spreads through direct contact with bodily fluids, blood, vomit, feces, saliva, sweat. And here's the really scary part. You can still catch it from someone who's already died. The virus can survive in a corpse. That's why healthcare workers and caregivers face the highest risk.
And the current outbreak involves a particularly rare strain, right?
Exactly. This is the Bundibugyo strain, which is different from the more common Zaire strain that caused the devastating 2014-16 West Africa epidemic that killed over 11,000 people. What makes this strain especially concerning is that there's no vaccine specifically for it.
No vaccine? So how do you actually stop an outbreak like this?
According to research published in The Lancet, early containment depends on what they call a comprehensive package of interventions. We're talking about rapid identification and isolation of cases, aggressive contact tracing, infection prevention measures in health facilities, safe burials, community engagement, and when possible, vaccination.
That sounds like a massive coordinated effort. Let's break this down step by step. What happens first when health officials suspect an outbreak?
Surveillance is absolutely critical. In the current outbreak, it started when a hospital in Bunia Health Zone identified a cluster of severe illnesses affecting healthcare workers in early May. Initial samples actually tested negative, but by May 15th, 8 out of 13 samples tested positive.
So they almost missed it initially?
Right, and that's why speed matters so much. Research shows that only 3 outbreaks since 2013 took longer than 33 days from symptom onset to confirmation. Those 3 outbreaks, they were also the only ones exceeding 150 cases, and they cost international donors a minimum of $1.8 billion and $730 million, respectively.
Wow, so early detection literally saves billions of dollars and thousands of lives. Once they confirm cases, what's the next step?
Rapid isolation. And here's where the data gets really interesting. A study from the Democratic Republic of Congo compared 2 approaches, traditional contact tracing versus community-based contact isolation. The results were stunning.
What did they find?
They studied over 27,000 contacts. The group that used community-based isolation had 0 secondary transmission, a reproduction rate of 0. The traditional contact tracing group had a reproduction rate of 1.14, meaning each case was creating more than 1 new case.
0 versus 1.14? That's the difference between stopping an outbreak and watching it explode.
Exactly. And the isolation group also had much better outcomes. The delay between symptom onset and isolation was 1.3 days versus 4.8 days, and the case fatality rate was 12.5% versus 48.4%.
Those numbers are incredible. But isolation is just one piece, right? What about contact tracing?
Contact tracing is massive. During the 2018-2020 outbreak in North Kivu province, they tracked 129,749 contacts. That's like tracking every person in a mid-sized city. The challenge is that it has to be done in real time while the outbreak is happening.
129,749 people? How do you even manage that logistically?
It requires an army of trained contact tracers who visit each person daily for 21 days. That's the maximum incubation period. They're checking for symptoms, taking temperatures, and immediately isolating anyone who shows signs of illness.
And then there's the really sensitive part, dealing with people who have died from Ebola. I imagine that's incredibly challenging.
Safe burial protocols are crucial because the virus can survive in corpses. The WHO has developed a 12-step protocol that's fascinating. It's like a choreographed dance between science and cultural sensitivity.
Tell me about that. How do you balance safety with respecting families and communities?
The burial team includes 4 members in full PPE, plus a sprayer, a technical supervisor, a communicator who works with families, and a religious representative. The protocol specifically states that no burial should begin until family agreement is obtained.
That's really thoughtful, because I imagine if you don't have community buy-in, people might hide cases or resist the response efforts.
Absolutely. Community engagement is critical. In the current outbreak, residents of Bunia are reporting that fear and panic are spreading, with funerals happening almost daily. If communities don't trust the response, they won't cooperate with contact tracing or isolation measures.
And speaking of protection, what about the healthcare workers themselves? They're on the front lines of this.
PPE is absolutely essential. The WHO updated their guidelines in 2024 with specific details about what protective equipment should be worn for different activities: screening, patient care, cleaning, and burial. They even have a strong recommendation against spraying healthcare workers with disinfectants like chlorine.
Wait, they were spraying people with chlorine?
Yeah, it was happening during PPE removal, but research showed it wasn't effective and could actually be harmful. It's a good example of how outbreak response has evolved based on evidence.
Now, what about vaccination? I know you mentioned there's no vaccine for this specific strain, but how does vaccination fit into outbreak response generally?
Vaccination has been deployed in 9 outbreaks since 2013, with the number of people vaccinated ranging from 550 to 345,000. There's a 500,000 dose global emergency stockpile that was established in 2021.
And how effective is it when you can use it?
A modeling study from RTI Health Solutions found that preventive vaccination for healthcare workers alone reduced cases, hospitalizations, and deaths by 11% to 25%. When you include frontline workers, that jumps to 14% to 38%. And if you can vaccinate the general population too, you see 21% to 52% reductions.
Those are significant numbers. But I'm curious about the human side of this. Can you tell me about some of the people affected by the current outbreak?
There's Dr. Peter Stafford, an American doctor and missionary working in the DRC who tested positive and was evacuated to Germany for treatment. His wife and 4 young children were also evacuated as high-risk contacts. It shows how this disease doesn't discriminate.
And healthcare workers are particularly vulnerable, aren't they?
Absolutely. In a recent outbreak in Kasai province, 4 of the 15 deaths were healthcare workers. In the current outbreak, it actually started with a cluster of illnesses among healthcare workers. They're literally putting their lives on the line.
That's incredibly brave. Now, I want to understand something. With all these interventions, how do you coordinate everything? It seems like it would be chaos.
It requires massive coordination. The WHO has something called the IPC ring approach, rapidly mobilizing teams to enhance infection prevention activities in geographical at-risk areas around infected individuals. It's like creating protective bubbles around cases.
And I imagine technology plays a role too?
Definitely. Diagnostic capacity has improved dramatically. 23 African countries now have Ebola diagnostic capacity compared to just 5 in 2010. They're using GeneXpert and PCR assays for rapid confirmation.
That's a huge improvement. But even with all these tools and protocols, outbreaks still happen. What are the biggest challenges?
Security is a major issue. The North Kivu outbreak happened in a complex security environment, which made contact tracing incredibly difficult. You can't trace contacts if your teams can't safely reach communities.
And there are other practical challenges too, right?
Absolutely. The WHO warned that the true scale of the current outbreak is likely larger than current figures suggest because many people remain in local communities and haven't been tested. You can't treat what you can't find.
So detection is still a challenge, even with better technology. What about the economic impact of these responses?
It's enormous, but here's the thing. Early intervention is so much cheaper than letting an outbreak grow. Those delayed outbreaks I mentioned earlier cost billions. Quick response saves money and lives.
It's like the old saying, an ounce of prevention is worth a pound of cure, except here it's literally billions of dollars and thousands of lives.
Exactly. And that's why Gavi launched a preventive vaccination program in 2024, allowing at-risk countries to request support for vaccination campaigns before outbreaks happen.
That seems like a game changer. Are we seeing this integrated approach work in real time with the current outbreak?
We are. The CDC and Department of Homeland Security implemented enhanced travel screening and entry restrictions. Flights from affected countries now have to land at Washington Dulles, where they can implement enhanced public health measures.
So they're trying to prevent international spread while the outbreak response happens on the ground.
Right, and the numbers show it's working to some degree. The outbreak has spread to Uganda, but it's been contained to just 2 cases in Kampala. Compare that to what could happen if these interventions weren't in place.
When you look at all of this, the surveillance, isolation, contact tracing, safe burials, PPE, community engagement, and vaccination, it really is like a precisely orchestrated response.
That's exactly right. The research consistently shows that you need all these elements working together. Miss one piece and the whole system can fail. It's why they call it a comprehensive package of interventions.
And the speed element seems crucial throughout all of this.
Speed is everything. Every day of delay in implementing these interventions leads to exponential case growth. That's why having systems in place before outbreaks happen is so important.
So when you step back from all this, what's the big picture here? We have this deadly virus, but we also have this incredibly sophisticated response system.
The big picture is that Ebola outbreaks are preventable and stoppable, but only if we act fast and do everything right. The tools exist, the knowledge exists, but it requires political will, funding, and international cooperation.
And community trust, which seems like it might be the hardest piece to get right.
Absolutely. You can have all the technology and protocols in the world, but if communities don't trust you, people will hide cases and resist interventions. That's why community engagement isn't just nice to have, it's essential.
It's remarkable that we've gone from not even knowing what Ebola was in 1976 to having this detailed playbook for stopping outbreaks.
The next time you hear about an Ebola outbreak in the news, you'll know there's an entire army of epidemiologists, contact tracers, healthcare workers, and community leaders working around the clock with a proven strategy to contain it.
Remember, every hour matters in this race against time, but we're not helpless against this virus. We know exactly how to stop it.